More on this, let's bring in Oladele Ogunseitan. He is a distinguished professor and founding chair of the Department of Population Health and Disease Prevention at the University of California. Professor, great to have you here with us on TRT World. So millions of us are asking the same question. How seriously should we take this global health emergency? Are we all at risk, or is this being blown out of proportion?
I don't think it's blown out of proportion. Thank you for covering this topic. We've had stops and goes in a couple of years. This particular outbreak is concerning because of the clade that was identified in the Democratic Republic of Congo. And when WHO says it's a public health emergency of international concern, we should take it seriously. Previously, we have been too slow to declare such emergencies, and it's been a problem. So this one is serious.
Now, Professor, if I may, if you look at these statistics and reports, certainly vaccines are in short supply right now, and I think it's fair to say that people are scared. Why is it that in 2024, we are still struggling to get vaccines to those who need them the most? Isn't this a repeat of past mistakes?
In a way, it is. We have not learned as much as we could have during the COVID-19 pandemic. Some of the supply chain issues that plagued the discovery, the delivery, manufacture of vaccines, and the vaccine hesitancy and behavior modification that needs to happen. I think that because we thought we had escaped Mpox in 2022 as a global emergency, we relaxed. And it's the times of peace when we're not really struggling to catch up with an outbreak that we need to prepare to prevent a pandemic. So this is that time now that all those lessons should come back and be taken seriously by all the local public health agencies and the general population.
Right. And Professor, of course, when you speak to doctors right now, they would say that the virus is mutating and the threat is growing. So my question is, are we sleepwalking into another pandemic, or do you believe the authorities are finally getting their act together before it's too late?
Right now, the clade that is worrisome has not been found, for example, in the US, but we all now know that people travel. I was in Africa last week at a conference where we talked about this. And so today, I'm glad that WHO listened to the experts and says everybody else in the world, even within Africa and outside Africa, need to be worried. So we shouldn't be sleepwalking into this. Vaccine manufacturers should commence right away. Public information should be out there to all people who are vulnerable. It is a contagious virus, maybe not as much as smallpox, but still very concerning, particularly because children and women have been very vulnerable in the countries affected in Africa. And we can't assume that that would not be the case outside of Africa.
Now, Professor, let me ask you something related to what I asked you earlier. Let's be honest, with Mpox spreading rapidly across continents, are we looking at a colossal failure of our global health system? And again, why were we not better prepared for this?
I think we are better prepared, but I don't think we have done everything we can. Particularly in terms of public education and campaigns. I think people generally, maybe even some officials, still think that this is a problem that's localized in special populations, but we cannot assume that. I think that we have the capacity to be prepared and to squash this. And that includes the declaration today. I think that's part of the process to get us all ready and on alert. And the more programs like yours spread the word, the better we will be. The regular hygiene conditions and examples that we've shown that are effective should continue to be part of the response of the general public and of public health emergency response and agencies.
Professor, very quickly, we're running out of time. What is your message to those who are watching us right now? How can they protect themselves from contracting this virus?
If you're in contact with anybody who shows symptoms, or if you're showing symptoms yourself, get tested right away. It's possible to manage this disease. It doesn't have to be a death sentence. The mortality rate, I think, is about 3% or less. So rapid detection and response is needed. Plus, all the hygiene practices need to be back on the schedule. Everybody needs to keep practicing those hand washing and cover your nose when you sneeze, and all of the things that we learned during the COVID are still quite relevant.
Professor Oladele Ogunseitan, thanks very much for talking to us here on TRT World. I really appreciate your taking out the time.
Thank you very much.